Yeah, well, clearly that's an overstatement. And what's most telling about that, you're referring to the National Comorbidity Survey that came out last year, is even the director of it, Ronald Kessler, he's the first to say that essentially it overestimated mental illness. He, in fact, said that the survey did not make a distinction between someone with severe mental illness and someone with a so-called emotional hangnail. I'm quoting him directly. And that is a flaw of the what we call the DSM-3, the Diagnostic and Statistical, now we're up to 4R, the fourth edition of the Diagnostic and Statistical Manual, which is the Diagnostic Handbook of the American Psychiatric Association. The fault is really with that document in that it has a pretty low threshold for making diagnoses. And so if you think of 1 in 4 people, that's obviously way too many. The way the survey broke people down, it actually did look at severe, moderate, and mild. And when you just looked at people who were rated severe, that was 6%. And I think that is an accurate estimate. I agree with you 100%. I think there are two sad consequences of it. One, we trivialize severe mental illness by doing that. Then we siphon resources away from these people, the severely ill, the psychotically ill, the homeless mentally ill. That's who we're talking about, people with schizophrenia and bipolar and unremitting major depression. And it's we can see the effects of this at the level, actually at the federal government. HHS has an agency that's devoted to funding mental health services, and I think it's very tragic that they have put so much money into the milder conditions, and meanwhile, again, services for the sickest, the ones who don't have the private insurance, are just drastically underfunded to the point where the LA County Jail is one of the largest, and Rikers Island, those two together are the largest mental institutions in the country. Right. Well, in fact, I just reviewed a book called 9/11, Mental Health in the Wake of the Terrorist Attacks. And this 600-page book, Cambridge University Press, told you far more about the mental health profession's response to September 11th than New Yorkers. What we do know about New Yorkers' response is that obviously some small amount of people did develop a clinical syndrome, but the overwhelming majority were upset, which is rational distress, and it went away. And among that small subgroup that were clinically affected were people who were either directly threatened, and in fact not even all of them develop so-called post-traumatic stress disorder or PTSD, or they're people who've had pre-existing psychiatric problems. So no, there was no epidemic of PTSD as was expected. And there's a trauma industry that does have an investment. It has a financial investment, but it also has an ideological investment. I think a lot of the people who are pushing the grief counselor movement and the trauma counselors and who did say there's going to be this great fallout of mental illness sincerely meant it. The problem is they were dead wrong. Well, one is a heck of a lot of wasted money. Referring to September 11th again, well over $100 million was spent on setting up counseling networks. No evidence that they helped people. So there's just a huge waste of money. It's a boon to the forensic domain because now people can basically not have true clinical pathology, but meet criteria for a diagnosis. And so if they feel that they have been harmed in some way and develop this condition because of it, the lawyers are thrilled. In fact, when the DSM changed a threshold for making a diagnosis of PTSD, the American Bar Association said, this is great news, more lawsuits for us. There's that. And then actually one of the things that I worry about the most, we'll talk about more later, is the implications for treating the returning veterans from Iraq, because there is in some quarters this prevailing notion that anyone who's been in combat is psychologically damaged and they need professional care. And just very briefly, I worked at a VA hospital for Vietnam vets, and they helped some men, there's no question about it. But a good number of them, I thought, were unfortunately funneled into a life of chronic disability where they could have been rehabilitated. And it's because we had this notion that war, inevitably causes mental annihilation. I think think I lean a little bit more towards the former. I think most people have common sense. I think they roll their eyes at these grief counselors. In fact, there was a cartoon in the New Yorker, two cowboys. One said, looking across the horizon, could be buzzards, could be grief counselors. I mean, when you start parroting something in the New Yorker, and vultures over Littleton, remember the Columbine kill? That was another column in the Washington Post. I mean, I think there's a healthy skepticism about this. So I worry more about people who've presented themselves, gone out of their way to present themselves to the mental health system, and that they do feel vulnerable for whatever reason, but this is a self-selected group, and that we as clinicians have a choice. We can push them in the direction of health or in the direction of victimhood and disability. And I think, unfortunately, the latter happens sometimes unnecessarily.